The Trump administration now declaring the drug epidemic a national public health emergency. And as the crisis just continues to grow, the FDA now says that opioid addicts should be treated with opioids. Here to discuss these developments is Dr. Mark Siegel of the Fox News Medical A-Team. Very special to have you with us today.
Heather, great to be with you today. Good morning.
So to a lot of people, this doesn't make sense. Why would this make sense to treat addicts with more opioids?
Well, the first thing is the antidote idea, which is opioid antagonist, something to block the work of opioids right in the brain. And that's called naloxone or Narcan. And they make it now so that you can actually spray it up your nose. And what's happened over the last few weeks, Heather, is that now Walgreens is putting it in 8,000 pharmacies across 45 states. And it's not going to be necessarily the addict. It may be a family member. It may be someone that knows that someone's in trouble that wants to carry it with them, like an EpiPen.
So you have to have a prescription to get that from
Absolutely
the pharmacy?
Not.
Oh,
this is now over the counter. Earlier this year, it was made over the counter. So it doesn't have to be a prescription, which is why I think it's like an EpiPen. A family member could be carrying it, or someone that just knows that someone's in trouble. And the problem with opioids is they suppress breathing, and that's how come we have over 30,000 deaths per year. So if you gave this, you would reverse that temporarily so you could get someone to medical help.
I know we discussed in the past, like even librarians being trained to use this type of medication.
And I think that's a great other place for it. All public areas. It should be in churches. It should be in libraries. It should be everywhere where someone
EMTs carrying it.
Yeah, EMTs are carrying it in most places, and there's a big thrust to get more to carry it. Now, the other issue regarding opioids, you were saying still take opioids. There's methadone, which basically isn't as powerful an opioid. That can be used over time to get addicts off of, things like heroin and Percocet. The other thing is something called Suboxone, which is longer acting over time. Suboxone is part of rehab. When you go there, you're addicted to opioids, and you take Suboxone, which includes Narcan in it, over time to get off of the opioid.
Well, I want to take a look at this graphic because you were talking about the number of people impacted by this, and it has dramatically increased. Within the past 20 years, take a look at this, just over 8,000 to now over 33,000 opioid deaths that we're dealing with.
One of the reasons that's happening, Heather, is because of the potency of these drugs. The different kinds that are on the market. Too many things were approved. And something like fentanyl, we've been hearing a lot about fentanyl, and the president talked about fentanyl yesterday. Fentanyl is now synthetic, and it's 50 times more powerful than heroin. You know what that does to breathing? You take that, so you start off with a drug that a doctor prescribes, but the next thing you know, you run out of that, he doesn't renew it, you end up on the street, you're using a synthetic drug like fentanyl that came across the border, and bam, you're not expecting the impact.
Yeah, the impact, speaking of that, of President Trump speaking about, the direct impact that this has had on his family with his brother Fred, was, I think, very emotional yesterday.
I thought that was a really powerful moment, especially because he was getting to something that we doctors know, which is that addiction is more than a disease. He talked about Fred, and you could see that Fred couldn't kick it. All Fred could do was advise his brother on how not to go there. And
don't drink alcohol, which he does not.
And 80% of opioid addicts also addicted to alcohol. So it's very relevant to talk about both.
Okay. All right, Dr. Siegel, thank you so much. Great insight.
Great to see you.